Good morning and welcome to Windows on the World. The United States is in the midst of a great national healthcare debate and a move towards reform. The debate centers around issues of quality, access, affordability, effectiveness, and regulation of our healthcare system. As the presidential election approaches, it has become a major hot-button issue, filling our print media, our airwaves, and our blogs with a constant stream of information, which is often conflicting. Sometimes the discourse is uncivil. So it is timely that today we have convened an expert faculty panel with expertise in social, political, legal, and ethical issues, particularly healthcare, to discuss with civility the future of U.S. healthcare as an issue of justice and Christian engagement. It's going to be a panel. I realize the panel isn't up here, and that's because I'm a middle child and I wanted to have the stage to myself for a period of time. It's true. My name is Dr. Wendy Mercier. I'm an associate professor in the biokinetics department in the College of Arts and Sciences. I teach courses in 3 programs: exercise science, biology, and nursing. I've been a nurse for over 30 years, and I practice part-time as a nurse practitioner, and I will be the moderator today. The reason the panel is down here is because I want to show you a few slides as a way of introduction and then bring our panel up. Paul, I wonder if you could turn down the lights that are on the screen. Thank you. So the cartoon has a doctor facing a patient and saying, "You're suffering from a chronic malady and fatigue secondary to significant therapeutic dissonance." Then the patient says, "Give it to me straight, doc." The doctor, "You're sick and tired of the healthcare debate." And I think a lot of us are sick and tired of the healthcare debate, but it's a debate that must happen, and I think today you will be impressed why. Before we look ahead to the future of U.S. healthcare, we should first take stock of our current state. Do you want the good news or the bad news? I'll start with the good news. Many diseases that afflicted Americans in the past have been eliminated, and many other cures and treatments that alleviate suffering have been discovered. The United States is a world leader in technological advances in medicine. We lead the world in another category as well: cost. The United States spends substantially more on healthcare than any developed country. In fact, healthcare spending in the U.S. is roughly 90% higher than in most industrialized countries. In 2010, healthcare costs rose to $2.6 trillion, far outpacing income, making up nearly 18% of our national economy. It's worth noting that nearly 2/3 of all bankruptcies in the United States in 2007 were due to illness and overwhelming medical bills. Among those who filed for medical bankruptcies, most were well-educated, owned homes, were employed in middle-class jobs, and had health insurance. Related to cost of health services is health insurance. Students, health insurance is the new gold. Since World War II, the majority of Americans have received health insurance through their employers. However, the cost of health insurance has escalated with the cost of care, and employers are now straining to provide the most basic of coverage as employees strain to pay higher and higher premiums. Significant disparities exist among Americans. Most low-wage workers have little or no chance of obtaining affordable coverage for their families through their work. Before the Affordable Care Act, more on that in a moment, 50 million Americans were uninsured. The most common reasons were cost, loss of job or change in employment, or loss of government benefits. Access to affordable health insurance is access to health care. We are the only wealthy, industrialized nation in the world that does not have a universal health care system. Forgive this statement if it is obvious. Everyone needs health care, and everyone uses the health care system. How does our high-priced, technologically advanced health care translate into the actual health of Americans? Here is some more bad news. There are several indicators of a nation's health, most notably infant mortality rate, which is the risk of death during the first year, and life expectancy at birth. The U.S. has a higher infant mortality rate at 6.9 deaths per thousand than at least 30 other countries, ranking us below such countries as Slovenia, the Czech Republic, and Cuba. Our life expectancy at birth is 78.5, not bad, but it ranks us 50th in the world, despite the most expensive health care. Here again, significant disparities exist among Americans. Life expectancy and infant mortality rates for people of color and lower socioeconomic status are worse than our national average. So our technological sophistication has translated into very expensive health care, diminished ability to pay for it, but not into better health. Dr. Atul Gawande is a Harvard-trained surgeon who writes for the New Yorker and New York Times with great insight and wisdom about American healthcare system. He said this: "As a doctor and citizens, I would take almost any system over the one we have now. My worry is less about what happens if we change than what happens if we don't." This brings us to the first point of agreement on the future of U.S. healthcare. Even Congress agrees on this, and I'm quoting the Institute of Medicine. "America's healthcare system is too complex and costly to continue in its current state. It is non-sustainable and needs to be reformed." You might be wondering, where is the debate? The debate, of course, lies in how we bring about reform, which brings us to the Affordable Care Act. On March 23, 2010, President Obama signed into law a bill to reform health care, called the Affordable Care Act, or Obamacare. After a challenge by Republican opponents, the Supreme Court upheld the law's constitutionality on June 28th of this year. I'm going to present to you some very basic facts about the Affordable Care Act. It is enormous and complex, and I can't pretend to be an expert on it, but I've tried to glean some salient points. First of all, by 2022, 33 million more Americans will be insured. This is the Congressional Budget Office estimate. Families below the poverty line will be covered by Medicaid. Below the poverty line is less than $29,000 per year income for a family of four. And then families with higher incomes will get tax credits based on their ability to pay, based on their income. This is on a sliding scale, and it's based on a percentage of income. Insurance premiums will be capped. This is also based on a sliding scale and family income. Those who can afford insurance coverage but choose to forego it will pay an annual fee. This is because everyone, whether they want to or not, needs health care, and everyone will use it. Small businesses who insure their employees will receive a tax credit. This only lasts for 2 years, but there is pressure on Congress to extend this. Insurance companies are not allowed to discriminate based on pre-existing conditions. They may discriminate on a few other things like tobacco use and, in a limited basis, on age. The law will impose a 35% tax on expensive employer-based insurance programs. This is a mechanism used to get employee-based or employers to choose affordable programs for their employees, and to get insurers to develop affordable insurance. The law requires insurance companies to spend 80 to 85% of premium dollars on health care or pay a rebate to customers. That is to be spent on health care and not on advertising, marketing, administration, and so forth. If you've been sleeping, this one particularly applies to you students. 2.5 million young adults have gained health insurance as a result of the Affordable Care Act that allows them to remain on their parents' insurance plan until the age of 26. This has already been implemented. And some of these other changes have been implemented, but some of them will roll out over time. I got the majority of this from the Kaiser Family Foundation Summary of New Healthcare Reform Law. I give this to you in the website. I'll put it up at the end because there's a lot of misinformation out there. And this is the best summary that I've read regarding this material. Okay, at this point, I'm going to bring up our panel and introduce them to you. Okay, first to my far right is Rita Borzillo. Rita is the director of the Fast Track MBA in Health Administration here in the Kampalo College of Graduate and Professional Studies. She teaches courses in health law, healthcare policy and management, organization of healthcare systems. She is also an attorney of law and has a long professional history of legal advocacy on behalf of children. She will talk to us a bit about the legal perspective of U.S. healthcare. Dr. Drick Boyd, next to her, is Associate Professor of Urban and Interdisciplinary Studies, also of the Kampalo College of Graduate and Professional Studies. Drick's life work and his heart has been in urban education and social activism. I think the title of a book he co-edited describes his professional passions well, weaving activism, scholarship, and faith. And he will look a bit at a political perspective for us. Lastly here, or closest to me, is Dr. Christine Jackson. She is a professor of nursing in the Kampalo College of Graduate and Professional Studies with a specialty in holistic nursing and integrative health care. She is also a nurse practitioner and, like me, a lifelong nurse. She received a national award last year for Holistic Nurse of the Year. And she's an outstanding yoga and Pilates teacher. She will give us a nursing advocate perspective, I'm sure. Dr. Paul Alexander is our fourth member who is not here yet. I hope he shows up. He's a professor of theology and ethics at the Palmer Theological Seminary, and Dr. Alexander will give us an ethical perspective if he comes. If he does not, I feel confident that these three will do the same. So, Rita, we'll start with you.
I'm going to start with talking about the opinion itself, because to me, it is an amazing opinion. It upheld our principles of federalism and judicial review, which to me is very close to my heart. The opinion has three major aspects. The first, and you've heard all these things, but I want to give you the reasoning behind it first. The individual mandate was ruled unconstitutional under the Commerce Clause. What Justice Roberts did, and he went back to what our founders back in the 1700s said, and said that the framers knew the difference between doing something and doing nothing. that gave Congress the power to regulate commerce, not compel it. This was the first time in more than a generation that the court put limits on the federal government's power to spend money. This all becomes important because we go back to Congress and how we implement the law. The second requirement of the act, a major requirement, is that he ruled that a payment of a financial penalty for not obtaining health insurance is reasonably characterized as a tax. In his opinion, he stated, "Because the Constitution permits such a tax, it is not our role to forbid it or to pass upon its wisdom or fairness. It makes going without insurance just another thing the government taxes, like buying gasoline or earning income. The question is not whether that is the most natural interpretation of the mandate, only whether it is one that is fairly reasonable or fairly possible." And he relied on a number of different issues or factors. The first is that for most Americans, the amount due will be far less than the price of insurance. So if you're taxed for not getting insurance, your tax will be very, very minimal compared to what you have to pay for insurance. Second, it doesn't depend on whether a person intentionally fails to purchase insurance. It doesn't matter. If you don't get insurance for whatever reason you want, you'll be taxed. It also prohibits the Internal Revenue Service, who is the organization that collects the tax, to use any type of punitive means to collect it. So they can't use any type of criminal prosecution. It functions as a tax because it leaves an individual with a lawful choice to do or not do a certain act, so long as they're willing to pay a tax. And it's like many other taxes that have been levied, it's an incentive to either influence behavior, but that does not change the nature of a tax. Most importantly, the one thing that the Supreme Court ruled unconstitutional was the law's expansion of Medicaid. The court held that the Medicaid expansion is unconstitutionally coercive of the states. The court said that in essence, the legislature and the president, through the law, exceeded their constitutional authority by coercing states into participating in the expansion, by threatening them with the loss of existing federal payments. The court's decision was the first time the spending clause legislation has been invalidated as unconstitutionally coercive of states. That's a first. What this opinion does in this part is it opens the door for Congress to litigate, to legislate every aspect of the law. Are they going to fund this? Are they not going to fund this section? Are they going to try and rule something unconstitutional or say it's unconstitutional? We don't know, but we don't know what Congress is going to do. As a general matter, Chief Justice Roberts wrote, "In the case of National Federation of Independent Business versus Sebelius, I offer no endorsement of the law's wisdom. Some decisions are entrusted to our nation's elected leaders who could be thrown out of office if people disagree with them." That is pure judicial review. He took the law, he said, whether we agree with it or not, it's constitutional. If you don't like it, use your power to vote to change it. A judicial activist court would have ruled the whole law unconstitutional, but what Justice Roberts did was give us the power to make the decision. The Supreme Court's decision to keep healthcare reform intact also gave us some other tax issues. So we have a Medicare surcharge on high-income taxpayers. There are people that make $200,000 a year or families that make $250,000 a year. You have a Medicare hospital insurance tax, and you will have a tax on your investment income. Cadillac health plans that were mentioned earlier, there will be a tax on them. Need to really look at the Cadillac health plans. Many unions and many jobs, because of job lock, offer really good health care plans that would be considered Cadillac, but you may not make a whole lot of money. So the Congress is really looking at what Cadillac health plans encompass and whether the definition of the law is what's going to stand. We have health insurance exchanges. It's a new way to buy insurance policies. It was set up to create a more organized and competitive market for buying health insurance. States are expected to establish exchanges. Pennsylvania had opted out. I'm not sure where they are with it at the current time. They have to let the federal government know by middle of November whether they're going to do an exchange or not. An exchange could be a government agency, it could be a nonprofit, or the state could join with other states through interstate compacts and form an exchange. Something that will affect every one of us is the itemized deduction. Currently, when we file our taxes, we get a 7.5% deduction on itemized deductions. That's raising to 10%. That's going to affect everybody that itemizes deductions, be you middle class, upper class, whatever you make. In fact, that's the tax change that will impact the most people. There will be a medical device tax, so an excise tax of 2.3% on the sale of any medical device. That will really hit the older generation who seem to have the need for more medical devices, and also the individuals on Medicaid and Social Security or subsidized funding, because they seem to need these type of medical devices. If they're getting a tax put on them, you know that's going to trickle down on what we have to pay. There's higher premiums for smokers. The extension of the health care to age 26, it's not just for students, it is for children age 26, regardless of marital or student status. So if my son, who is now a junior in college, graduates, gets married, I still have to cover him till he's age 26. So it's not just being in college, it's regardless. A lot of things are already said. To reduce the costs of Medicare, it creates a panel of experts, the Independent Payment Advisory Board, and it was formerly known as the Medicare Commission. With the goal of reducing the growth rate in Medicare spending, the IPAB will be responsible for developing payment reform proposals if projected Medicare spending exceeds certain predefined targets. I want you to remember that, because I'm going to talk about that a little bit later. Most importantly, unless Congress enacts its own legislation regarding the proposals, so the IPAB will give a proposal. If Congress is to not enact their own legislation, the Secretary of Health and Human Services must implement those recommendations. So we could have recommendations implemented by a panel of individuals that are appointed, political appointees, without any vetting, without any investigation, other than these individuals on this board. Lots of different names for this board. I just ask you to think about, do you think maybe we should have some input when they talk about how they're going to change our health care? We talked about employers not offering adequate health care plans. They'll begin paying a penalty this year. They have to have health plans that have minimum health benefits. They have to have sufficient levels of coverage, and they cannot be too expensive. And this includes employers that have 50 or more employees. This is becoming a really big issue because employers can limit or reduce any increased cost by strategically structuring their workforce to consciously stay below the threshold of 50 employees, or limit the number of full-time employees. That is to say, employers can design a workforce that relies on individuals other than full-time employees to conduct business and not be required to provide health care. They could use part-timers, and they could use independent contractors.
Rita, about another minute.
That's all? Okay. Just know that there are businesses that are already doing that, Darden restaurants, McDonald's, and that we may need follow-up legislation to ensure companies don't do it. I want to mention the federal deficit. There's been a lot of discussion about the federal deficit, and that we really don't know what's going to happen, because what the federal Congressional Budget Office said is our calculations are based upon the law as it stands and no changes in the next 20 years. We don't know what's going to happen. So will there be differences? Will there be an increase or a decrease? There will, but we don't know what that will be. I want to mention very quickly, there has been health care reform in Pennsylvania. There's been a substantial decrease in the medical malpractice cases that have been filed in Pennsylvania. There's been a substantial decrease in the rate of high verdicts. And lastly, what I need to really stress is that you are the future. It is so important for you to vote. It is so important for you to know the issues, because if we're going to make change, if there's going to be change, you have to go and vote. You have to know what your legislators stand for. If they're not what you believe in, you need to change that. You need to vote, not just in presidential elections, but in your county elections, in your state elections. You need to vote. Thank you.
Thanks, Rita. Drick?
Can you tell I feel strongly about that?
And Rita, we'll come back to you.
Okay.
Good morning. If you have watched the presidential debate, the first presidential debate, if you've been reading the news, you know that this topic is very politically charged. And so I want to talk a little bit of maybe some things that aren't as evident with regard to the political side of this. And I start my presentation with two assertions. One's a conviction, and the second is a fact. The conviction is this, that in one of the most developed countries with one of the most advanced medical systems, at least in terms of the science, affordable, quality health care should be a basic human right. Let me just say that again. A quality, affordable health care should be a basic human right. That's where I start. If the Supreme Court can affirm that owning a gun is a basic right of all Americans, we as a people should be able to affirm that affordable, quality health care is not an option for only those who can afford it, but it is a basic right. The fact is that income disparity is one of the key indicators of a person's relative overall health. The Centers for Disease Control, the CDC, says that income disparity in the United States is the highest among advanced industrialized economies. And it's one of the reasons that you see those statistics of our rankings in things like life expectancy and infant mortality. The CDC has shown that rates of premature death, infant mortality, low-quality housing that leads to all sorts of respiratory and other kinds of diseases, obesity, low relative air quality, and access to health care are directly related to one's educational level and one's family income. The less income and the less education you have, the more likely you are to be unhealthy and unable to get help. So I guess the thing there is we can't talk about health care in isolation from all the other issues that are related to it. Now, it's interesting that the poor are actually a little better off than the near poor because of Medicaid. Medicaid is a government program that provides health care for the poor. Now, it doesn't take away all those environmental factors I mentioned, but at least they have access to health care. But nearly 40% of the near poor, so that's those who are above that $29,000 per family of four, 40% of the near poor in 2008 were uninsured. And since 2008, with the recession, my guess is that percentage has gone even higher. So here's the discrepancy. We have this advanced medical technology, but a significant part of our population can't access it. And this is what the bill known as the Health Disparities and Affordable Care Act, often referred to as Obamacare, and even just referred to as the Affordable Care Act, but the Health Disparities and Affordable Care Act is designed to address. And there are many reasons why we can't seem to get this passed, but I think, let me just focus on one, and that is that a major obstacle to attaining this goal of quality, affordable health care for all is that in this country, we treat health care as a commodity, as a product, something you buy rather than a right. It's sort of like if we said, well, if you want to breathe this air, we'll have to look at what the market tells us it's going to cost you, and if you can afford it, then you can breathe. That's the situation we have with regard to health care. Now, the major health insurance companies like Aetna, United Healthcare, Cigna, are all publicly traded companies. In other words, they are on Wall Street, and they are beholden to their stockholders. Now, Independent Blue Cross is not a publicly traded company, but it is a for-profit company. And you see, this sets up a divided loyalty for those who are running these companies. Do we focus on bringing profits and providing dividends for our shareholders, or do we give quality health care to the people that are buying our product? And if you've ever been to a doctor, you know that when you go to a doctor, you've got about 10 to 15 minutes, no matter what your issue is. If you've ever had to go to the hospital, you know, before you ever walk into the hospital, they've already told you how many days you can be there. And that's not because the doctor decided it, but because the health insurance company said, this is what we've decided this is worth. So that even the medical professionals, in many cases, are not being able to determine the level and quality of care that you get when you get it. Now, these companies are working overtime to make sure that you and I are confused about what this bill is all about and what it's seeking to achieve. OpenSecrets.org is a website that you can go to that tracks lobbyist and campaign contributions. And according to OpenSecrets.org, the healthcare industry was the 5th largest contributor to political campaigns thus far in 2012, giving over $166 million to political campaigns. Interesting, 124 million of that 166 was by the pharmaceutical companies. Go figure. Now that doesn't count money that went through super PACs, which are those large political action committees that hide who the contributors are. And I was driving on Roosevelt Boulevard just yesterday. There's a huge billboard says "Repeal Obamacare," and under this is some generic name of a super PAC. So we don't even know how much money is actually being put. But what we can track, it's a significant amount of money. And you see, that money is the money that you and I are providing our healthcare companies to go and lobby to restrict access to affordable health care. So there's a discrepancy here. So why are politicians dragging their feet on this? Why are they fighting on passing a law that guarantees everyone a right to health care? Simply because they're being paid not to. Plain and simple. Somehow, when we wanted to go to war in Iraq and Afghanistan, cost was not an issue. Somehow, when gas companies in Pennsylvania want to drill in the middle of the state and the governor says we can't tax those companies, we can go ahead and do that. But when 50 million Americans cannot afford health care insurance, and when that health care is the best in the world and is readily available, they can't seem to find the money because they don't have the will. It's a matter of misplaced priorities and the worst kind of injustice. The Old Testament prophet Amos cried out against the wealthy oppressors of his day when he said, "You sell the righteous for silver and the needy for a pair of shoes. You trample on the heads of the poor as upon the dust of the ground and deny justice." In this case, affordable health care to the oppressed. Changing the system is extremely complicated, but it starts with we as a nation deciding that we will make health care a right, make health care a priority, that will join the other developed nations of the world, all of who provide universal health care, and say, yes, as a citizen of this country, you deserve this. Because health care is not a commodity. It is not a product. It is a human right.
Thanks, Drick. Okay, Chris?
Okay, amen to that, Drick. I've been a participant observer in the United States healthcare system since 1974 when I started drawing my first paycheck. And I'm sure that healthcare is a right that everybody should have. What I'm not sure about is that we do have the best healthcare system. In other words, it's not enough just to reform the way that our system is offered and the way that our system is financed. We really have to reform the very basic content of the care that we provide. The good news is that begins with each one of you here. It begins with each of us. We can take charge of our own health care to a great degree. And if we don't do this kind of micro reform. Our system's headed for a breakdown no matter what we do. And I think that Obamacare is a good first step in at least ensuring that everybody has access. But access to what is the question? We don't want to give access to something that's not of high quality. And so that's what I want to talk about. Our system is focused on an illness and pathology model. Physicians are trained to focus on illness and disease. We have an allopathic paradigm of healthcare. Allopathic means against. So it's based on drugs and surgery that work against the symptoms that we see in the body. So if you look at all drugs, they're antibiotics, anti-inflammatories, antiemetics, anti-seizure, antihypertensives, antihistamines, everything is anti because allopathy is against. In other countries, most of which have a national healthcare system, physicians are actually rewarded for keeping people well. If their patients lose weight, if their patients exercise, if their patients stop smoking, they make money. In our country, our physicians make money for doing interventions, for prescribing drugs, for doing surgeries. These carrots are very different, and they lead to a very different philosophy of care. One that has better outcomes, one that has poor outcomes. And as you could see from the slides, and that was just a touch of the data, if you look at our outcomes in the United States, they're terrible. They are terrible. Life expectancy, infant mortality. If you start to break it down and look at all the subcategories of outcomes, they're terrible. In the United States, we don't do well. We do pretty well in trauma care, taking care of people who've been injured in accidents and things like that. Some infectious diseases. Chronic illness, terrible. Mental illness, terrible. Heart disease, terrible. It's not good. So, we have to look at the incentives. The other thing, and Drick, I think you already said this, healthcare is in a greater context. You can't reform healthcare without looking at education, neighborhoods, quality of water, quality of air, quality of the food supply, and the types of foods that people eat. You guys have seen Super Size Me, you've seen Fast Food Nation, you've seen all these things. All of this counts when you look at health. In addition, a truly effective healthcare system looks at the innate healing ability that God gave each one of us. Inside of each of our bodies, we have a drugstore of drugs to tap into. Our body makes anti-infectives. We have an immune system. Our bodies make anti-inflammatory agents. Our bodies can handle our pain. We make endogenous morphine called endorphins and enkephalins. We have endogenous antidepressants. Our bodies make serotonin, dopamine, norepinephrine, all these feel-good things. We have to learn how to tap into our internal drugstores. And in teaching yoga, one of the things I like is that nothing's a panacea, but yoga is pretty much approaching a panacea for treating physical and mental health care. And the robust research data is almost shocking to me. Even though I've been doing yoga for 20 years, it's shocking to me to see how effective it is. If you look at a meta-analysis of research on depression and what works to treat depression, you'll find that exercise and St. John's wort, which is an herb, are as effective as antidepressants. And they don't have any of the negative side effects that a lot of the antidepressants have, including suicide, especially in young people, side effects of antidepressant drugs. So, I was in practice in a busy pediatric practice outside of Coatesville for 11 years. We used to see hundreds of children a week, myself and 2 pediatricians. And we had an ice storm in the winter of like 93, 94, and this tri-state area was blanketed with ice. Nothing was moving. Nobody could get anywhere. Our doors were closed for 4 or 5 days, almost a full work week. No children were seen in our practice. Nobody could get to the ER. Nobody could get to the drugstore to even get a prescription if they needed one. At the end of the week, or the following week, the beginning of the week, I was sitting down with the 2 pediatricians. We saw no one. Every child was fine. Every kid got better. Do you know what I'm saying? Without medical intervention, every child was okay. Their innate healing mechanisms kicked in. Supportive care, common sense. They were all fine. And so, when you look at our interventions, the data is staggering. It's estimated that a third of the deaths in our country are caused by prescription drugs prescribed at standard accepted doses. Okay? So you have to take into account, the quality of the interventions that we're offering in the first place. Abraham Maslow, one of my favorite psychologists, said, if your only tool is a hammer, every problem looks like a nail. And we have a healthcare system where physicians and even a lot of nurses are taught that drugs and surgery are those are the jewels in the crown of treatment. But that's not true. There's robust evidence to indicate that modalities, ancient and new, that have nothing to do with drugs and nothing to do with surgery work far better, and you use them in combination. So, massage, exercise, herbs, nutraceuticals, other forms of a body work, other forms of guided imagery, all kinds of things, and you use what works, and a sprinkling of medications here and there, and maybe a surgical procedure here and there when it's absolutely necessary. That's what works. Other countries are more open and receptive. Like in Germany, they've been using herbs and aromatherapy for forever, and in other countries, there are other healing systems, Ayurveda, traditional Chinese medicine. They get good results. We need to be very curious about looking at these systems. And so healthcare providers like physicians and nurses and other disciplines become coaches, guides, walking alongside patients. Because ultimately, we need to become experts in our own bodies, and we need to reform healthcare from within. We need to take responsibility for our own health instead of looking outward, trying to find a magic bullet, going from doctor to try to find what's wrong with us. Start tuning in and figure out what's wrong inside yourself. I have asked every age of patient that I've ever taken care of, what do you think is going on with your body right now? They always know. I did an experiment once for a few months I was working down in Philadelphia at a federally funded clinic. And I asked every kid that I saw with any kind of an injury that was like a sports-related or musculoskeletal injury, what does your body want now? Does it want heat on here or does it want cold on here? Because we say cold in the first 24 hours and then heat after that, right? When it was early, they always wanted cold on their injury. When it was later, they wanted heat. They knew. They knew what their body wanted. They knew what their body needed. And so we have to start tuning in. There are so many chronic illnesses that self-care is all that's necessary. For diabetes, for asthma, you need to know how to use your medication if you're insulin dependent or when you need your inhaler. But there's so many other things you do on a daily basis to take care of yourself. And this is really important. There has been greed. Can I start talking about some ethical concerns since Paul's not here?
So you're going to take Paul's?
Cheers.
Absolutely, absolutely.
Well, okay. Well, anyway, so I've been at this a long time. I'm really 85 years old, but because I do yoga, I just look better than I really am.
There it is. There's the piece.
I know. No, really, unfortunately, I'm pushing 60. But the thing of it is that for the first third of my career, I saw greed and ethical breaches on the part of a lot of physicians. Not all of them, but a lot of them. They were milking a system that has had a lot of money. Healthcare has a lot of money because people think they need it. It's a well-endowed system. And I saw a lot of physicians taking advantage, making rounds on their patients in the morning without even a stethoscope, never touch the patient, 3 minutes, hello, good morning, how are you? Write a quick note, they're out of there, and they charge $75 to the insurance company. And other kind of things. Pop a pimple, call it a surgical intervention, charge $125. Okay, I have seen this. Now, not all physicians were exploiting, but it was an easily exploited system. Then big pharma, you could see how pharmaceutical industry was exploiting the system. Charging $3 for a pill, and they still do this, and saying, oh, well, the research and development, it costs us so much to develop these drugs. No. They were spending as much or more on marketing and multicolored shiny brochures and wine and cheese parties and dessert parties and coming to medical and nursing conferences and wining and dining us and coming and bringing sandwich trays to our practice, coercing us to prescribe their drugs or their formula. And then soon the insurance companies took over. They wanted their piece of it. And the insurance companies, with 20% administrative costs, 10 to 15% of their costs, millions of dollars going to underwriting to refuse people insurance based on pre-existing conditions. 10 to 15% of their costs going to people then to refuse claims once you're insured, but you make a claim, but then it gets refused. All of this goes away in a national health system. All of these financial abuses, a lot of them, not all of them that I've talked about, but a lot of the private insurance, ethical breaches could go away. And I want to use hip replacement as an example. We hear that in other countries that have nationalized insurance systems, you have to wait so long for treatment. First of all, that's gotten a lot better. You don't have to wait so long. But something that's an elective surgery, like a hip replacement, you have to wait a really long time. And people will say, well, in Canada, you've got to wait a long time, and in the United States, you don't. But the interesting thing is that who pays for most hip replacements in the United States?
Medicare.
Medicare, a government-run system that has very low administrative costs and is not too shabby, as Adam Sandler would say. So anyway, Rita alluded to tort reforms. We've got to put limits on lawsuits. I mean, physicians cannot be crippled by their malpractice insurance rates. I also think that true reform begins within each of us. We have to start taking responsibility for our own health care, keeping ourselves healthy, making wise choices of what we put in our mouths, what we drink, what we eat, the air we breathe, what chemicals we put on our body in personal care products, what we do in terms of moving our body. We've got to keep, ourselves moving, keep ourselves moving, and that's how we stay healthy. So, in closing, I hope to see a truly reformed healthcare system that begins with reforming ourselves from the inside based on our God-given innate healing mechanisms and our God-given common sense. Thank you.
Thanks. I have about 1 million questions, but I would like to hear a few questions from the audience for this panel while we have them together. I might add that one thing that's missing from this panel is what healthcare providers such as physicians feel is their role in all of this in reform, because we can't have reform by government unless healthcare providers also participate.
Can I make one point?
Yes,
when we
Rita.
talk about reform, the other point that's very important to me is we've become a very litigious society.
Yeah.
And part of the cost of healthcare is that litigation. So if you go in for a procedure and sometimes procedures don't work out right, not through any fault of the doctor, not through any fault of the hospital, not through anyone's fault, but it didn't work on you. We sue. We're going to sue them. We're going to sue them. We have to stop being that litigious society. We have to accept, you know what, it didn't work. We need to deal with that rather than sue, because what happens in the lawsuits, the insurance companies force the doctors to settle. You have very few trials. There's a settlement, and then the doctor can't get their insurance, or their insurance is very expensive because the insurance company says to them, oh, you have all these lawsuits.
Okay,
So a lot of
Rita,
it's on us.
I just want to add, thank you. I just want to address a question or two if we can. Any questions? Just stand up and speak out. Hi, Amy.
Hi. Dr. Jackson, your talk about holistic medicine is very appealing and makes sense. But I'm wondering how that works in a context, particularly in urban and rural, probably mostly urban, poor neighborhoods where fresh air, fresh food, and safe places to exercise are not available to people. How might a person in that kind of community approach holistic medicine and the type of health that you talk about?
Well, I think that, a holistic approach, it does involve the context. So all of those societal, all of those other factors matter. Where you can't control your water quality, you could still, if you could afford to buy a water filter, you can filter your water, the Brita water filters. You can't control the air where you are. If you can afford fast food, you can afford to buy healthy food. There was an interesting research study that just looked at a large sample and found that anybody can eat healthfully for the same price that you eat unhealthfully. People think that healthy foods cost more money, but actually you need to be educated about how to make proper food choices. And so anybody can be taught that. But everybody, more and more we're seeing rural and urban populations using holistic modalities, seeking massage, using acupuncture, using nutrition, exercising. I don't think that is based on income or where you live. It's a matter of education, exposure, and teaching people. And you could be a health educator and go into a very poor setting and start teaching people how to take care of themselves and how to keep themselves from needing healthcare interventions.
Drick, I think
it's been done, and I've done it myself.
I think this is close to your heart, this question.
Yeah, as in the introduction, I teach in an urban studies program, and it's interesting, the last couple years we've had farmers come into our program. And you wouldn't associate farmers with urban work, but they're particularly interested in urban farming. And actually, Philadelphia is one of the places where the urban farming movement is really beginning to take root. It's interesting, I live just a little bit south here in a town called Broomall. And I would say within walking distance of my house, there are 3 grocery stores. And if I want to drive 10 minutes, I can go to another 2. And then if I really want to do more than just grocery shop, I can go to Target or Walmart because they're now selling food. If I go down 10 miles to Chester, a city of 40,000 people, there's not one supermarket in that store. Now, why do I mention that? Because this is part of a much broader issue of trying to create sustainable communities. You mentioned air quality, you mentioned water quality. The city of Chester was a big industrial city and actually was famous. I went to a conference in Texas and found out that it was famous for fighting environmental racism because there were...
Martin Luther King went to seminary there.
Martin Luther King lived there and preached there for a while too. But after King got there, they were fighting the companies that were polluting their air and polluting their water and polluting their ground. So I think, when we talk about holistic health care, we really need to think about not just as individuals, but we really need to think about the kind of communities we're creating. Do we have parks? Do we have grocery stores? Do we have places where kids can play and be safe? And while that may not sound like healthcare, if you listen to what Dr. Jackson said, it's all about healthcare and all about healthy living.
Okay, I'm going to summarize. It is so big, and it is so complicated, and there's so much about this healthcare animal that we have to learn. I would emphasize, particularly for you students, since it's mostly students here, that you read reputable sources and become really educated, well educated on healthcare from legal and political and personal care perspective, that you go out and advocate for the less fortunate than yourselves, and that you vote in what you want to have as good health care. Okay, thanks so much for coming. Thank you, panel, very much.